Hot Like Pepper, part of the Rhythms Communication Network. Right now, on the line, joining us at this time is Dr. Shivan Mahabir. He's a psychiatrist, and today we're talking about a very important topic, which is dementia. And Shivan, thanks so much for joining us.
Hi, good morning, everyone. Thanks for having me.
All right, so let's talk about dementia. First of all, off the bat, what is dementia? We've heard the word, we know the word demented comes from dementia, but what is this disorder about?
So, dementia is a syndrome which is usually long-lasting and progressive, meaning that it gets worse over time, and it can be caused by a variety of brain illnesses. And what it does is it affects a person's memory, thinking, their behavior, and their ability to perform everyday activities. And why this is a very important topic at this time is because in general, the world's population is an aging population. And dementia tends to affect the elderly more so than the young. And as the population ages and the proportion of the population gets older, you're going to see more and more persons with dementia. So that presently estimates that there are 50 million persons worldwide who are currently living with dementia. But by 2050, which is in just about 30 years' time, this is expected to triple to just about 152 million persons.
Yeah, that's a lot of people, and there are not too many stats involved for local, but I mean, we have seen many instances of it. In fact, off the air, you would have pointed out that there were several instances in December, and one recently in central Trinidad, which is not very far from where I'm sitting right now, where a woman turned up. She had no idea where she was, and she ended up at the police station, and people were posting pictures of her online to ask the family to come and get her because she had no idea where she was.
Yes, that's right. Elderly persons wandering away from home is a fairly common experience, and sometimes there has been tragic endings to those stories. Thankfully, in the story you mentioned, which happened recently, they were able to locate the relatives, and I believe she's receiving the appropriate care at this time. But it does go to show that we do need to start thinking about this because, as you say, there are not a lot of statistics locally. It tends to be something that isn't recognized for what it is, and that is because persons think that, it's normal to lose your memory as you age. However, this is actually not a normal part of aging. This is an accelerated and debilitating process that these persons are going through, and it creates a lot of hardship for them and their families and their caregivers. So it is something that we need to bring to the fore at this time to try to sensitize persons to what is going on and help them to understand, well, what are the things that we can do to prevent it, or in the early stages, what can we do to recognize it, to try to seek help as soon as possible?
Well, following up on your last statement there about the causes and about how to recognize it, let's just talk about the causes of dementia for the moment. There's also a difference between dementia and Alzheimer's disease, which I think people are far more familiar with. You've heard about Alzheimer's. I mean, it enters the lexicon also. But what exactly causes dementia? According to there's so many causes to it. Mostly, what causes the deterioration of the brain that shows up in dementia?
Right. So,
yeah, I know it's a wide question. You can talk about this for days, but the summarized version.
Sure, of course, yes. Well, first let's look at some of the risk factors. Now, there are some risk factors that you cannot control, such as your age, your family history, or if you are a person who has Down syndrome, which puts you at an increased risk of having dementia. So these are things you can't control. However, there are other risk factors that you can control. For instance, you would try to decrease your alcohol use and try to keep it to a minimum, no heavy alcohol use, no smoking. Try to control your diabetes through a healthy diet and exercise. Try to make sure that your cardiovascular risk factors are under control. So that's looking at things like high blood pressure, making sure that that's under control as well. You would want to look at persons who have sleep problems, who may have sleep apnea, which is a potentially reversible cause of dementia. So sleep apnea can be treated, and sleep apnea can lead to cognitive decline. And if it is treated, the person can resume their normal functioning. Additionally, you want to make sure that you're taking in sufficient vitamins. So certain vitamins are recommended: vitamin B6, vitamin B12, and vitamin D. Apart from that, you would ask persons to have a yearly checkup and to make sure that the thyroid gland, for instance, is functioning properly. And also certain medications, the side effects of those medications can lead to cognitive impairment. So if you're noticing a problem with a person's thinking and they're on medications, you should have a talk with your doctor about whether any of the medications might be contributing to that.
Right. So those are some of the risk factors, and perhaps you don't want to use the word causes too much, throw that around, but some of the risk factors for dementia. Now, as we get closer to 7:26, let's talk about some of the how you can spot it, because if I forgot where I put my keys or my cell phone, that's not exactly a sign, well, I'm suffering from dementia. Forgetting is part of it. But, I mean, we forget things every day. I hope, Shivan, Dr. Mahabir, that you haven't forgotten the wife or girlfriend's the anniversary of meeting her, because you might be in some trouble for that. But what are the signs? How do we spot that somebody is perhaps is suffering from dementia and they will have to seek some treatment?
Right. So as you rightly said, Vidya, everybody forgets things from time to time, and you could misplace your keys or your cell phone, and it isn't an issue as long as it isn't happening regularly or repetitively. However, if you do notice that you are forgetting things on a very regular basis, and you're always losing track of what you're doing, and you're always putting down things and you can't find them, it might be a good idea to speak to your doctor, because oftentimes one of the problems with dementia is that it's not recognized until it's reached a very advanced stage often, because by then the changes are very, very, very noticeable. But by then, the amount of help that we can give to patients is a bit more limited. So if you are thinking that, look, you know what, I've really been having a lot of memory problems recently, and you're getting on in age, it might be a good idea to bring it up with your doctor. But some other things that we can look for, persons losing words. So they're trying to name something, but they can't remember the name of it. And it happens to all of us from time to time. But again, if it's happening more than before, very frequently, it's something to watch out for. Getting lost in familiar places is a very key sign. So they may be driving to a place that they are accustomed going, and they may get lost along the way. That's a very key sign. They may have difficulty managing their finances or their shopping. So they're going to the grocery store, they're getting confused, they're not buying things that they are accustomed buying, basic things. This is a sign to look out for. Persons becoming confused in the evening time as it gets dark. This is a phenomenon called sundowning, and it is something that is seen in patients with dementia. Additionally, persons, as things get more advanced, they may notice personality changes, so becoming angry more quickly, becoming frustrated more quickly. They may become depressed or anxious. They may become scared and untrusting of people who they know. And in the very advanced stages, they may actually begin to hallucinate, see things that are not there or hear things that are not there.
Yes, and from the way that you describe it, it sounds very, very distressing indeed. Now, as you mentioned, the anger, paranoia also shows up towards the end, and those who would have dealt with people who suffer from dementia would talk about the fact that sometimes they accuse family members, neighbors, unnamed people of stealing from them also, because sometimes, let's say they paid a bill, for instance, there's $200 missing from their wallet or so, and they've forgotten. And a certain amount of paranoia comes in, and that's one of the ways in which dementia can cause enormous problems within families.
Yes, that's correct. And oftentimes it will be that the person themselves has hidden away precious items for safekeeping, but then cannot remember, that they did it or where they did it, and then they would think that someone has come into the house and taken it. And because their frustration tolerance is lower in that setting, they may actually lash out, become violent, become aggressive. That is something that we see quite commonly, yes.
We're speaking to Dr. Shivan Mahabir. He's a psychiatrist, and he's on with us usually on Wednesdays to talk about serious issues. And we're talking about dementia today. We've had a rash of cases in which elderly people have been found in different places, and some have no idea where they are. There was a case last week of that happening. I did witness, Dr. Mahabir, one particular case of this when I was younger. It really sparked my interest in dementia. There was a gentleman who was trying to get home. I remember I was standing outside his house speaking to one of his children, and he kept driving past. So they stopped him. This is in front of his home where he's lived for 50 years. And they asked him, "Where are you going?" He said, "Well, I'm trying to drive home, but I can't find it." And he was driving up and down. And in fact, when they stopped him, as I mentioned, right in front of his home, and he had no idea. He couldn't recognize the house itself. Just speak a little bit about the private hell in the mind of the person suffering from dementia.
It would be really difficult for me to.
Yeah, well, I mean, you don't, but I mean, from what the research says, especially the paranoia part, it is very distressing for the person.
Yes, it is very distressing for the person, and it's also very distressing for the family members who are seeing this person that, oftentimes it's your parents. So you grow up, they're looking after you, they're providing everything, they're doing everything, and now you're seeing somebody who is unable to help themselves. And that brings on a lot of frustration in the family members because they feel helpless to help. They feel guilt that this is someone who did everything for me, and now I cannot give back to them. I cannot look after them as they need to be. On the side of the patient, I think if we just stop for a minute and try to imagine what it's like to know that, okay, I'm looking for my house, I'm looking for my home where I live. This looks like the right street, but something is wrong. I don't recognize the house. And as you said, he was driving past you and his children, which meant that he also didn't recognize his children as well. Otherwise, surely he would have stopped and said, "Hey, help me! I'm trying to find home." So, in that state, that confused state, it's quite debilitating. It's quite frustrating. It's very, very difficult for me to put it into words.
Yeah, it is. It is a very distressing thing. I saw a case where someone could not even recognize. They could recognize that this person is their child, but they couldn't remember their name. And I mean, that is very, very distressing indeed. Now, one of the aspects of dementia that we just want to mention here, of course, the effect of COVID is one of the big ones. But before we go to that, dementia and Alzheimer's disease, they do